Hello viewers, I'm Dr. Shadli Tausif Amim, founder and CEO of Paces Walk MRCP Dhaka. I'm here to discuss about some vital topic of MRCP Paces, that is low back pain. You know that one of the common station 2 or station 5 that it can be some back pain. So it is very common, no? So we're here to actually discuss the approach of back pain in cases of paces. You know that station 2 and station 5 is quite similar, and only the difference is that station 2 you have to take the elaborated history and you don't need to examine the patient, and in case of station 5 you just have to shortly take the history. Those are the vital parts, and along with that you have to examine the patient with great focus, and concise format of your examination is actually expected from the examiners. All right, so right now the back pain, the most vital thing is that whenever you are dealing with a case of back pain, you have to at first look at the patient or have to read the scenery very carefully. Like, it will vary, the differentials will vary from the age of the patient, also the gender of the patients. All right, and some relevant data like investigations might be there, so it might be give you some clue. All right, so right now I am coming for the what are the paces differentials for the back pain. So right now I want to divide it by two parts, that is, one is inflammatory and another is non-inflammatory. So which are the inflammatory type of the back pain? Most of the cases these are actually the spondyloarthropathies, like ankylosing spondylitis. It can be reactive arthritis, it can be psoriatic arthritis, it can be enteropathic arthritis. Mostly this might be coming in the inflammatory group. And in case of non-inflammatory, there are some other causes. Those are actually the mechanical, and apart from them some other causes might be there. So first I can tell you that it can be some traumatic origin, or it can be some osteoporosis that is leading to some mechanical pains. Along with that, it can be some osteomalacia. It can be like some malignancies that metastasize to the vertebra, or that means what should I say, bony mets. Sometimes it can be like multiple myeloma. Some multiple myeloma sometimes presents with back pain. And apart from that, it can be some spinal tuberculosis, that is Sports disease. Okay, and rarely sometimes the Paget's disease, it can also presents with back pain as well. Most likely that is non-inflammatory type. So whenever you see the age of the patient, if the patient's age is elderly, then you should at first think about the non-inflammatory things, and if the patients are basically young, then start thinking that it might be the inflammatory. So right now you have to distinguish between the two, whether it is inflammatory and non-inflammatory. So right now just ask for some vital questions, that whether it is only the back pain or whether there is some other pains like neck pain, or pains in any other joints, any swelling there, any redness or any hotness, or you can say that any early morning stiffness. So and some swelling in some other parts of the joints. And apart from that, some other questions like any eye involvement or any multi-organ involvement. So it's actually denoting that the patient might have some inflammatory conditions. All right, and if you get that there is no such thing, no signs of inflammation, and it's actually non-inflammatory type, there is no morning stiffness, there is no redness, tenderness, swelling, or what should I say, no morning jamming. So if these things are there, so you can think of it can be non-inflammatory origin. So in that case, whether you go to inflammatory or if you go to the non-inflammatory, then suppose you get that it's a condition that is actually inflammatory, then you have to ask for certain things like for psoriatic arthritis you have to ask for any skin disease in the family, or any nail changes, or any skin rashes anywhere else. So you have to ask for that. it can be angst-spawn. All right, so in that case you have to ask for any family history of like ankylosing spondylitis. You have to see for any extra articular manifestation of the ankylosing spondylitis, and also some other specific signs like plantar fasciitis, Achilles tendinitis. So all these things you have to check for. And apart from that, for the enteropathic arthritis, you have to look for what about the bowel pathologies, what about the bowel motions, is there any loose motions or any bloody diarrhea or anything like that. All right, and you have to check for some other pathologies as well, like any eye involvement, uveitis. You have to check for any urethritis. So these are the common associations. So if you get the diagnosis of inflammatory arthritis, then you have to reach to the definitive diagnosis. It can be ankylosing spondylitis, it can be psoriatic arthritis, it can be reactive, or it can be enteropathic arthritis. And in case of suppose non-inflammatory arthritis, so you have to think that okay, so what might be the pathology. You at first start with the trauma, then look whether there is any risk factor for the osteoporosis, like any steroid intake or any hypogonadism or any other things, or like celiac disease patients having malabsorption syndromes that is causing some bone thinning and bone pains as well. So this might be another possibilities. And apart from that, you can think that okay, so the patient has some previous history of any malignancy. So ask for any in old age patient, ask for any previous history of any malignancies, or then you just see that whether there is any possibility of metastasis or not. And apart from that, you know that sometimes hypercalcemia might be associated with the malignancy. So always look for any signs of hypercalcemia, that is bone pain, like renal stones, polyuria and polydipsia. So whether there is any features of hypercalcemia or not. Another thing is that, you know, another diagnosis I told, that Pott's disease. So whether there is any chance of any tuberculosis or not, or any fever or anything like that, any cough or any traveling to the endemic zone, so it can be Pott's disease. So you have to deal like that. Apart from that, what I told, that another differential, it might be some multiple myeloma. There might be some vertebral collapse or vertebral fractures related to that. And even in that case, you will get the features of hypercalcemia as well. So you have to deal with that. All right. So this is how you will approach to the case of a back pain. And when you reach to the definitive diagnosis, then you will have to look for different things, that whether this patient has some associations with some other conditions, like whether this patient having ankylosing spondylitis. All right, so what are the complications that might arise in a case of ankylosing spondylitis? So let me tell you that it can be uveitis, there might be some conduction defects in the heart, there might be involvement of the heart like aortic regurgitation, there might be some pulmonary fibrosis, you know, and in sometimes you can get that the patient has some other involvements of some other joints as well. So you have to correlate all the things. Okay, like in case of like what should I say, vertebral metastasis, okay, spinal mets. So in that case, you will get that the patient might have some features of spinal cord compression. So you have to look for any features of any endangering things, that is some spinal cord compression. The patient might have some issues with urinary retentions, some bowel abnormalities. The patient might having some difficulties in walking. So you don't only diagnose this case as your diagnosis. Also you have to look for any associations, risk factors, and also the complications. When you deal with all these things, that is the association, risk factors, and the complications, in that case your examiner will be very much sure that this candidate is very much matured and he is going to pass the paces. This is totally absolutely fine. Now in case of back pain, like you are dealing this case in the station 5, so you have to do the certain examinations to make your examiner happy, right? So at first it will depend whether this is inflammatory variety or non-inflammatory variety. Suppose let's first talk about the inflammatory variety. So if it is inflammatory type of back pain, in that case you have to do some tests, like you have to check for the sacroiliac tenderness, you have to check for the spinal movements, you have to do the modified Shover test, and not only that, you have to check for other joints whether there is any pain anywhere else, like any neck pain, any heel pain, or pain in the Achilles tendons. So you have to check for pains anywhere else. Apart from that, you have to check your hands as well, whether there is some other pathologies in the hand, and also the nails as well, whether there is anything in the nails. And you have to do the total skin survey to look for any psoriatic patches or psoriatic rashes. Alright, and apart from that, another test you have to check for, that is walking test, and also the occiput wall test, to see whether there is any the occiput wall test is okay or not. Apart from that, some relevant examination, you know that a case of inflammatory arthritis might have some cardiac complications, like I told you that ankylosing spondylitis cases might come with aortic regurgitation, so you have to check for the cardiological examination for aortic regurgitation. Apart from that, you know that there might be some, what should I say, pulmonary fibrosis, so you have to check for the just auscultation. Alright, apart from that, you know there is some restrictive pathologies related to the angstphone, so you have to check for the chest expansibility. So this should be the your examinations pattern. And in case of non-inflammatory type of the back pain, you have to check for the tenderness in the back. And apart from that, it is very important that you actually exclude the spinal cord compression, like you have to check for whether there is any urinary bags, or the patient's leg movements is right, and what about the SLR test. So you have to check for any abnormalities there. Alright, and apart from that, you have to exclude any inflammatory pathologies presence or not. So this is how you deal a case of back pain in case of PACES. Alright, so hope you enjoyed our session. We'll come back with some other exciting complaints. Alright, so stick with the PACES work. You all know that our course is one of the best in whole world, and recently within last 2 years we have 45 candidates passing the PACES with great score, and one of the candidate got 170 out of 172 from PACES work MRCP Dhaka. And right now we are running our course in the online and offline as well, and we have candidates from 6 different countries like US, UK, India, Pakistan, Malaysia, Bhutan, and also Bangladesh. Alright, so apart from that, we have some candidates who got more than 160. That is a very frequent score right now from our course, and hope you join us. And we have a great pool of mentors, like 15 mentors currently working with us. So join with PACES work and pass the PACES in the first attempt with the flying score. Thanks a lot. Good night.